consultant in reproductive medicine and assisted conception at Fertility Plus and Fertility courses. So today I'm going to talk to you about a topic that often gets asked. What should be the time duration or time difference between an antagonist in an antagonist treatment cycle of IVF and the agonist trigger? So what is the normally followed policy? You would give the antagonist in the morning and 12 hours later give the agonist trigger. So the logic behind it is that the pituitary sites where the GnRH antagonist occupy need to be displaced, and if you give it at a very short interval, that displacement does not occur. Now, this has been tried and tested, and I think this needs to be questioned. Now, what we do know is that as GnRH antagonists occupy the pituitary GnRH receptor sites by competitive inhibition, they have to be displaced by this effective triggering. So you need to find out the effective trigger post. How do you find out if the trigger has worked? And it's by doing a 12-hour LH test. So what did this trial do? It had 53 patients, and the time interval between the GnRH antagonist and the agonist was group 1 was less than 2.5 hours, group 2.6 to 4 hours, group 3 4.5 to 7 hours, and group 4 more than 7 hours. So you're giving a duration. Remember, the first group was less than 2.5 hours, which means you gave the antagonist and within 2.5 hours, you gave a trigger. And blood sampling was kept fixed. It was kept fixed at 8 o'clock in the morning where you did an LH test. Now, what did the study show us? It showed us that there was a 0% failed retrieval rates, which means that irrespective when you gave the trigger, and the difference was the retrieval rate, you always got eggs, and there was no difference in oocyte recovery. So let's go back to the basics. The half-life of ganirelix is 16.2 hours, and that of citralix is 20.6 hours. So now the GnRH agonist trigger can displace, and this is what we know, it can displace the GnRH antagonist from the pituitary even within the first half-life, irrespective of when it was taken. And that's how effective it is. Now, what do we think is an effective trigger? Which means that how do we measure an effective trigger? One is to measure the LH, and that's 10 to 12 hours after the trigger, and it should be more than 15 milliequivalents per liter. And that is one way of measuring the trigger. The second is to also measure progesterone. So what happens with progesterone? Granular cell luteinization to high progesterone levels, and that's also a key indicator, and I'll do that in another talk. And that should be more than 10 nanomole per liter, and both of these will give you a brief idea into whether your trigger has worked. But what we also know that a very small dose of an agonist trigger is required to displace the antagonist, and this is what has been shown in the study and in some other studies. So in summary, tell us that logic of giving the antagonist in the morning and then doing the agonist trigger in the evening in research doesn't tell us much. We think that irrespective of how short the duration is between the antagonist and the agonist trigger, it is likely to work. And that time difference, and there's questions of saying, should I give the antagonist in the morning, and what should be the time duration or time difference between the antagonist and the agonist trigger, is something which I think as time goes by will stop. Do like this page, and thank you very much.